Welcome back to the Care Innovation Studio. We have our next guest with us. Would you like to introduce yourself, tell us who you are and what you do?
I'm Oonagh Smith and I am the Chief Executive of Skills for Care, and Skills for Care is the workforce body for the social care workforce in England.
Perfect. So we're obviously at an innovation conference talking about innovation. You're doing a talks in a short while. What are you going to be talking about?
So I'm going to be talking about the adult social care workforce strategy that we launched in July last year, so almost exactly a year. We're coming up to the first anniversary, and it was a collaboration between the whole sector, providers and commissioners and people drawing on care, looking at what we need in the future and how we start to build that. So I'm going to update people on what we've done with the workforce strategy and where we're going next.
Perfect. So what have you done and where are we going next?
Yeah. So the workforce strategy sets out a 15-year strategy for the social care workforce, and we start by talking about, well, why do we need a strategy? And in social care, we project in Skills for Care that we're going to need an extra 540,000 people working in social care by 2040. And that's based on just demographic changes, really. That's not set in stone.
On top of the
1.6 million
okay,
people that we've got today.
Yeah.
And that's not, there's things that we can do to change that. We can make some policy choices, we can do care differently, but we're always going to need more people. And not only do we need more people, we're going to need people with different skills, and that's because our own needs are changing as people who are using and drawing on care. So we're expecting a 43% increase in the number of people with dementia by 2040, and we're expecting a 100% increase in the number of people over the age of 85 by 2047. And some of that's wonderful. You know, we're all living longer, that's great. We're not living healthier, and so the complexity of the needs that people have are increasing, and we can see that today. And so I think in Skills for Care we believe that we can sit back and say somebody needs to do something about this, or we can, you know, roll up our sleeves and do something ourselves, because these demographic changes are coming whether we do something or not. So I think we need to do something, and we owe that to the current people drawing on care, and we owe it to future populations. So within the workforce strategy we got together everybody with an interest really in the social care workforce, and we've had quite a lot of actions that have already happened off the back of the strategy. So one example, which is particularly relevant to innovation, I suppose, is a piece of work looking at a care technologist role. So what does technology look like, and what's the kind of intersection between social care practice and technology, and how do we look at different roles in social care that can make the most of both? We need everybody in the workforce to be confident with technology, but is there a specific role as well? And the National Care Forum has just got funding to pilot a care technologist role because of the workforce strategy, and that will give us a sense of the roles and the skills that we're going to need in the future. And I think in kind of broader sense, thinking about innovation, it's not that we don't have innovation in social care. You'll have heard it today. We've got so much innovation in social care. It's that sometimes it relies on pockets of good leadership. And what we need to do is have a system that supports innovation and is thinking longer term, thinking about the skills gaps that we are going to have, the different ways of delivering care that work in the best interests of the people drawing on it, because we're all living quite differently. And so instead of it being just pockets, we've got to normalise some of that and spread it and scale it. And I think that's some of what the workforce strategy is trying to do: join people together, have slightly different conversations, more empowering conversations, so that we're not saying this is what somebody else needs to do. We're saying this is what we all need to do within our own space, and how do we just crack on and start doing some of it.
What we found is that through today, talking about innovation, is that actually most innovation is small things. It's the small little changes that you make. You know, giving your home care worker staff contracts that include travel time. Yeah, and if you don't do that, doing that for your company is an innovation, right? Yeah, it doesn't have to be a £50,000 AI powered something or other. It can be just simple little things that make a difference. And I think maybe that's what we get a bit confused about, is the idea that innovation can be simple.
Yeah. Can I tell a story that I think just really shows innovation at a human level in social care? I worked for MenCap for 8 years or so, and I did a visit to one of our services, and I met a young support worker who had done an aromatherapy course, and she was supporting a young woman, let's call her Michelle, and Michelle only had the use of one arm. She couldn't see, she couldn't hear, and this young support worker was quite curious about how she could use aromatherapy. Michelle, even though she had the use of one arm, it didn't seem to be conscious use, so it flailed around a lot, so she couldn't feed herself. Our team was supporting her to eat. We didn't know what food she liked, we didn't have a sense of what she liked. This support worker decided, I'm just going to try something, and so she started to spray a scent 10 minutes before she supported Michelle to get out of bed, a different scent for lunch, a different scent when her mum was visiting, and what they found was that Michelle was able to then understand and have a sense of control of her own life. She knew then what was happening and when things were coming, when she was eating, when her mother was visiting. Her arm then completely calmed down when she was eating. She started to be able to feed herself, and she started to be able to then show us what she liked to eat. And she didn't like peas, but she loved chocolate. I'm just making that up. But we were then able to make sure that when we were cooking for her, we were cooking food that she liked. And given taste was one of the only senses that she had. The impact of her being able to eat food that she actually liked was so huge. And her joy at knowing that her mother was coming just kind of spread that moment for her, so that she was able to kind of predict it. And that was the innovation that came from a relationship and a bit of curiosity, and the freedom within an organisation to allow this young woman who'd done an aromatherapy course to try something. And I think that's sometimes where some of the real innovation comes that affects people's lives.
For a few pounds worth of
essential oils.
Essential oils, yeah. Again, that's another beautiful example of just simple things that can make the difference. And I think, thinking about, as a sector, thinking about innovation from that perspective is going to be really useful. So with the sort of workforce plan, I guess that, you mentioned that it's going to be a 48% increase in dementia, people with dementia. Maybe that's not your area. I guess someone needs to be working on that, don't they? And say, right, how do we prevent that happening? Can we make that 40% or 35% through, better health and different things? And there's different people we've spoken to today that would be in that area. And I guess in your area with the workforce, is there tangible things that you're, as an organisation, going to try and do to kind of say, right, either we're trying to make that number smaller, so that extra 500, so that end up being 2.3 million or something like that. Can we make that 2 million or 1.5? What are you aiming to try and do over that period?
So the Alzheimer's Society is a key partner in the workforce strategy, and what we've recommended in the workforce strategy is that everybody in social care needs to be trained to understand and be able to support somebody with dementia. Minister Kinnock has announced that will be government policy. He's announced that in Parliament. So things like that are really important for the workforce. It's making sure that we have the right roles and the right skills for the needs that we have now and the needs in the future. So one of the most recent things that we've done as Skills for Care, 20 years ago, if you were going into a care home, for example, you would have driven yourself up in your own car maybe and unpacked your own boxes and moved in. It's very rare now for anybody to go into a care home unless they're in an ambulance. People have real health needs, often multiple health needs.
I would say the acuity is much higher, isn't it? And
absolutely.
Speaking to care homes, I often say, this is what we're delivering now is what an ICU would have been delivering in the 70s and 80s.
I mean, the stuff that our staff are doing now, our non-clinical staff, is what we might have expected a district nurse to do 10 years ago. So these are really highly skilled roles, and so what we were seeing this in Skills for Care, particularly during the pandemic, when a lot of health professionals couldn't get into social care, and we were seeing more and more tasks being delegated to social care. And so then from a workforce perspective, what we wanted to make sure was that people had the right skills in order to do diabetes management and wound care and catheter management, so that was being done in a safe way. And so we've been working with the Department for Health and Social Care to look at what are the principles of safe delegated healthcare and what are the barriers to that, and how do we remove some of those barriers. So really some of the barriers are the money doesn't necessarily flow for providers, so more tasks moving to social care, the money needs to flow. We don't always have enough nurses who are able to supervise clinical interventions, so we need to really value the social care nurses that we have, and we need to recruit them and keep them. And then sometimes people just don't have the training. The training is something that's easier to be able to deal with. We can put training in place and roll that out, but we also need to make sure that we take a step back and understand that the boundaries between health and social care now, because of people's changing needs, are very different from the boundaries 10 years ago, 15 years ago, and we need to have a different conversation, and that's where the innovation in practice needs to come from. We're going to need different people having different conversations around different tables, because needs are just so different.
And does your estimate of the increased number of the workforce, does that include a kind of, you're taking some people off that because we're improving care? Does that factor that in, or is it kind of like this? If we do nothing, this is what we think.
It's a really blunt tool, or really blunt calculation that just looks at, if we look at the over 65 population, and if care grows, if the number of people working in care grow in proportion to that population, what would we need? So it doesn't take into, so we have choices. We can make that number smaller if we do the right things. It might also be bigger if we don't do public health well, for example. We might end up with a sicker population.
If that's 52% rather than 46%.
Yes, that could increase. It also doesn't take into account the younger population moving into adults, because we just don't have those figures. And what we can see from children's social care is that packages of support are becoming bigger, and people have more support needs. They're becoming more expensive. Well, how does that translate then into the needs that people are going to have in adult social care? And that's a real that's a gap that we have. We can't see that. What we have done, so we've been doing that projection for more than 10 years now. Skills for Care has a data set that covers about 700,000 people working in social care, so it's really robust data. And so we've been doing that projection, and we've gone back over the last 10 years to say, okay, how accurate were we, recognising all of the kind of issues with the fact that it is a blunt tool. And it's been pretty bang on, actually, other than during COVID when the workforce grew more than we had expected. So even though it's not a prediction, it is a projection, it has been a very good indicator of how much the workforce has grown. So if we do want to shift that, we're going to have to do something quite different, I think.
Lovely. Well, I have a final question for you. Scones, cream first or jam first?
Do you know, it's like the whole marketing industry for scones has failed me, because I have no view. I both, either, any order. It's like Marmite. Marmite has built a whole industry around do you love it or do you hate it? And I'm just a bit either.
Well, yeah, the National Scone Society is somewhere going, oh yeah, everyone's asking this question, aren't they? Starting battles online, social media battles online. Well, thank you very much for coming. It's been lovely to talk to you.
Yes, thank you so much. Lovely to meet you.
We'll be back shortly.